Early in the year, one of our largest clients in our Virginia practice was marketing their stop-loss insurance. That particular claimant had some difficulties at birth.
This baby had been born very early. There had been multiple surgeries that the baby had to undergo. The infant experienced a cardiac arrest and then subsequently had developed cerebral palsy.
The stop-loss had an increase of 20% at renewal. 20% equated to roughly $200,000 on this particular client. One of those actually had a laser attached to it. Which basically means that the client would have additional exposure to a certain point before the carrier would assume the risk.
I was very familiar with this baby already. I had been working with the carrier registered nurse so that we could understand how this baby's care was being managed.
We subsequently reached out to Kate Villette with our PATH department and Jenna, who is our actuarial specialist. The two of them were able to work within our clinical team at PATH and the data analytics that are involved with PATH to extract both a diagnosis, prognosis, as well as provide some predictive modeling on future claims costs.
And when the baby went home, they were discharged with skilled nursing care at home. And that's where a lot of the conversation with the carrier nurse and myself had been going in that direction, to identify that they had gone through the corrective surgeries that were needed on those congenital heart defects. Moving forward, that surgery did not need to be repeated.
Working with Kate and the PATH team, we were able to reduce the incumbents increase, which is 20%, brought it back down to 0 or no change.
The laser that was applied to that baby was done so based on the historical claims.
We also were able to reduce a $500,000 laser, and that was huge.
We also knew, working with the carrier nurse, there were no prior authorizations in place for that baby.
This particular client chose to stay another year with the incumbent because of their longevity and the comfort they had with this particular carrier.